I would like to thank you for the invitation. I would like to thank also Mattea, with whom I have collaborated to write this paper. Introduce myself. My name is Luca Ceraolo. I'm a philosophy student at the University of Torino. I'm about to graduate, and I will continue with a master in psychiatry. So, in order to introduce our paper, I would like to tell you something about the background that this paper has. The first factor is linked with a personal experience of mine. Since I was 16 years old, I have been volunteering in this little town that you see here, which is called Sighet in Romania. And here in the picture you can see the Spitalul Municipal, so the hospital. And I volunteered there in psychiatric structures. And what the reality I went through was to meet patients who are constrained in cages, who are left to themselves naked. So it was pretty impressive for a 16 years old boy to face that kind of medical treatment, which was actually dishuman. And so I started to get interested in psychiatry and to address philosophical reflection towards psychiatry. The second factor of the realization of this paper was linked to another meeting with Mattea a couple of years ago, and we met in Lille in a conference where the key point was interdisciplinarity. So what I would like to say is that in medicine, as the human body can't be just considered in a mechanicistic way, but it involves cultural, educational, personalities, factors. In particular, in the domain of medicine, in order to develop therapies which are addressed specifically to the patient the doctor faces, it could be important to implement within education an approach, an holistic approach, as you can see, that is in dialogue with the reflection and the contribution of social sciences and humanities. So my background is in philosophy, so I will focalize in particular on philosophy, but in general the holistic approach, you can see, takes into account disciplines such as sociology, economics, law, in this complex schema where there is a dialectic relationship between the different domains. So the problem of values in psychiatry has been, we have dealt with the problem of values in psychiatry from two perspectives. The first one is the perspective of a contemporary philosopher of science, whose name is Rachel Cooper. Rachel Cooper has studied and is a philosopher that analyzed the 5th edition of DSM-5, so the Diagnostic and Statistical Manual of Mental Disorders. And she mainly deals with epistemology and philosophy of science. The second perspective is that of Franco Basaglia, and I will speak a little bit more about him. And I have underlined this difference because while Rachel Cooper is an analytic philosopher, Franco Basaglia was actually a psychiatrist. He was Italian, but his medical praxis was deeply influenced by a completely different kind of philosophy, so existentialism, phenomenology, and also Marxist category. So the two perspectives are functional in order to let you see that within the same differences that are typical also within the domain of philosophy, there could be nice approaches towards the same problem. So the main purpose of the paper is that of to answer the question of how to prepare, how to educate physicians and in general health workers to treat mental patients with humanity, with compassion, with respect. Okay, I will firstly go in this second slide. So this slide asks, is schizophrenia a natural kind? Natural kind is a notion, a technical philosophical notion, as you can see here, that so says that to say that a kind is natural is to say that it corresponds to a grouping that reflects the structure of the natural world rather than the interests and the actions of human beings. So to make you some examples, chemical elements are considered natural kinds. Plants are considered natural kinds. And here you can see there is the picture of a dandelion whose scientific name in Latin is Taraxacum officinale. In order to answer to this question, so if schizophrenia is a natural kind, so something that can be described just in naturalistic terms without the compromission of some value judgment which are involved in the consideration of illnesses, I used a literary escamotage, and I wrote a little story whose main character is Jones the gardener. So in this story, you can imagine that there is Mr. Smith who hires Jones the gardener, and he tells Jones, okay, I want you to remove dandelions because I hate those infesting weeds. So, as you can see, I have spoken about dandelions, and I have used three terms to describe dandelions, to speak about them. The first one was Taraxacum officinale, the scientific name. The second one is dandelions itself, and the third one was infesting weed. As you can see, when I speak about infesting weeds, in my description, in my linguistic description, I am comprehending a value judgment. So the problem of value-ledness, the problem of language in psychiatry that we face within this paper is exactly this one. Is schizophrenia a term that can be used in a neutral sense, such as Taraxacum officinale or dandelion, or schizophrenia itself involves a negative value judgment because its profound nature is that of being an illness. And this is what is called the problem of value-ledness. Value-ledness that can be applied to language, as in this case, and I hope I have been clear in exposing this example, or that can be applied to theory. Actually, the right definition of value-ledness is that to say that a science is value-ledness is to say that the theories developed by scientists are shaped by the values of scientists themselves. So this is these are problems that we face throughout Rachel Cooper's perspective, and Rachel Cooper offers a solution. I will not go through the details because I think I don't have time, but this was just to introduce you a kind of problem that values and language in psychiatry could go through. And finally, I offer you a solution. So I mentioned before that the second perspective was the perspective of Franco Basaglia. Franco Basaglia was an Italian psychiatrist that led a revolution between the 70s and the 80s in Italy. This revolution led to the approval of a law 180, which was established in 1978, and that established the closure of asylums. So Basaglia identified some years ago the same problem of value-ledness that Cooper identifies, but in a different way. So as I said before, he is influenced by continental philosophy, and he says that within capitalistic society, mental illness is a problem because, as Michel Foucault says, mental illness is absence of work. So the mental ill person is someone that does not produce, that does not contribute to the economy of the capitalistic system. So we produce what Basaglia calls an ideology of diversity, and we have historically put all the mentally ill people together in total institutions, in asylums. And Basaglia says that throughout our language, we produce a symptomatology. So he does not say in this sense that mental illness doesn't exist, but he says that as we produce a symptomatology throughout our language, the way we want to manage the problem is implicit in the language we use. So this is, again, value-ledness in psychiatry. And the solution he offers within his medical approach, within his medical praxis, is linked with the concept of meeting, which was elaborated starting from some reflection of Karl Jasper's in his Allgemeine Psychopathologie. And the concept of meeting is that of let the relationship between the health worker, the physician, and the patient be a relationship firstly in terms of person towards person. So you have to, Basaglia says that you have to understand, in order to understand the illness, you have to understand how the person you are facing has conceived his or her worth, and this is at the base of what could be a human approach within psychiatry. So to conclude, this paper has the aim throughout these two perspectives to let people see that interdisciplinarity and the dialogue between hard sciences or medicine in this case and humanities or social sciences can be developed in order to let the quality of medical praxis arise and improve. Thank you for your attention.